और अल्लाह ही है जिसने तुम्हारी नफ़ा के लिए रात बनाई ताकि तुम उसमें आराम कर सको, और उसी ने दिन को देखने के लिए रोशन बनाया। बेशक अल्लाह ताला का लोगों पर बड़ा ही फजल है, लेकिन अक्सर आदमी उनकी नेमतों का शुक्र अदा नहीं करते। ये अल्लाह ताला है तुम्हारा रब, हर चीज़ को पैदा करने वाला, उसके सिवा कोई इबादत के लायक नहीं। सो तुम लोग शिर्क करके कहाँ उल्टे जा रहे हो? इसी तरह वो लोग भी उल्टे चला करते थे जो अल्लाह की निशानियों का इनकार किया करते थे। अल्लाह ही है जिसने ज़मीन को मखलूक के लिए करारगाह बनाया और आसमान को छत बनाया और तुम्हारा नक्शा बनाया, सो उम्दा नक्शा बनाया, और तुमको उम्दा उम्दा चीज़ें खाने को दी। बस ये अल्लाह है तुम्हारा रब, बड़ा आलीशान अल्लाह जो सारे जहान का परवरदिगार है। वही जिंदा रहने वाला है, उसके सिवा कोई इबादत के लायक नहीं। सो तुम खालिस एतकाद करके उसको पुकारो। तमाम खूबियाँ उसी अल्लाह के लिए है जो तमाम जहान का परवरदिगार है। सदक़ल्लाहु
to be in Rahman Medical Institute. Professor Zaid Aman Saab, he is our chief guest, he is dean of this institute, and Professor Sanawala Jan Saab, he is director of this institute. So, I will just briefly first mention the teams. We have 3 teams. Each team has 5 participants. Each participant is from first year, second year, third year, fourth year, and one is from the community icon. So, I will briefly introduce them. These are our 3 teams. The group A is side lovers. They are standing right behind you. They form Fawad, Alia, Manahid, Anam, and Jissa. And the second team is for 1A anhydrase inhibitors, and they are standing here. They are Shagusta, Sakina, Pushpa, Hamid, and Sania. And the third team is trap forces. They are standing right here. Ahad, Zafar, Amir, Suhail, Leena, and Aram. There are few. I have judges. You have got the scoring sheet, so you will score each of the team. The few rules of this quiz: that each correct answer carries 10 marks, each incorrect answer carries 5 marks. There will be 5 marks. That means that it will be -5. And if you don't know the question, you can pass the question. Then there will be no reduction from the answer. The result will be just 0 marks to you. In case of true/false, there will be no pass on to the next team. And each question has 30 seconds. You have to answer in 30 seconds. Okay? And I will request all the audience to please maintain the silence. And no one should give any hints to the team about the answers. So, sir, with your request, with your all permission, should we start? Thank you, sir. Okay, so this is from Group A, side lower. First question to you. The normal intraocular pressure of an average person without glaucoma.
C option.
C. You mean C 10 to 21. Okay. Okay, correct answer. So I request the audience to, you can back up your teams by clapping. Group C, the trap forces. Glaucoma causes blindness by affecting visual cortex, second cranial nerve, cornea, or retina.
Retina.
Retina? B, retina.
Second allowance.
The first answer was retina. So you should answer.
Second.
Okay, next time we will not allow this.
Okay, sir.
There should be first answer will be considered as the last answer.
First, you discuss with your group.
Yes, you have 30 seconds. You discuss with yourself. Second cranial. Okay, it is right.
They are right by answering both B and D.
Okay.
Because ganglion cells lie in the retina and their axons are blocked. Okay, so both are
Both are okay. Fact ours. Open angle glaucoma is associated with sudden loss of vision.
False.
False. Okay, correct.
इसमें मशवरा करके फिर एक बंदा बोला था।
तो इस मशवरा करके एक बंदा आंसर दे, 5 बंदे आंसर दे। Okay, inhibitors. Glaucoma can affect children. Is it true or false? True. True. Correct. The trap forces. Surgery is necessary for all cases of glaucoma. Is it true or false?
False.
Correct. So now we will be increasing the level of difficulty. Okay. Group A, side towers. The test used to measure the anterior angle of the anterior chamber. What is that called?
Gonioscopy.
Correct. Carbonic anhydrase inhibitors. Spirometry is used for?
To measure the corneal thickness.
Correct. Trap forces. What is the principle of destination tonometry?
Corneal attenuation. Flattening the cornea.
What is the principle? What is the name of that principle?
Yeah, law.
Yeah, law.
And with law.
This one.
Correct. Inverted. This is difficult.
أول warm up.
Oh, the word was yati.
Please start.
5 seconds.
Where optic disc?
Okay, where?
Time is up.
Time out.
Time over.
Time out. So I'll leave it to the judges. They said it is near to the optic disc. Group A, side tower. It is actually superiotemporal or inferiotemporal nerve fiber layer adjacent to the optic disc. Now judges will decide. Group B, inhibitors. What is the dot sign? Acha.
Sir, decide. Correct. Show answer.
Correct.
Correct.
Great.
What is the dot sign?
बहुत ज़्यादा हो जाती तो डॉट्स जो है वो ऑप्टिक डिस्क में लगा दें।
Okay, correct. Okay, so now
मेरा ख्याल में रूल में कहीं लिखा नहीं है ये अब इनका एक्स्ट्रा
हाँ इनको एक्स्ट्रा मार्क्स करेंगे बाकियों को 0-0. Okay, this is from group C, trap forces. Angulations of blood vessels in glaucoma, which occurs at the optic disc. What is that called? Hands up. So, the pass should automatically. Negative, wrong show.
Zero mark.
The minus there. From trap forces.
जवाब zero.
G group A.
ये bonus question है।
G? Nasalization and और दूसरा क्या कहते हैं? Okay. Flattening of the vessels. Okay.
सर ये वाला क्वेश्चन पास नहीं हुआ because they haven't said it so
नहीं तो पास हो गया ना किसी ने भी जवाब
skip
नहीं
करेंगे सर इसको
नहीं मेरे ख्याल में उनको उन्होंने आंसर दे दिया उसको नंबर देने चाहिए ठीक है इतना वो नहीं Okay, this is from side towers.
Please.
World Glaucoma Association WGA encompasses of how many glaucoma societies worldwide? दाव मातम परून पता लगेगा.
Pass.
Pass. ये नहीं पास है, बस तीनों ने पास कर दिया. तो ये स्किप हो गया सर. ये मेरे ख्याल में कितने 80? 91. जी inhibitors. Time is up. Do you want to answer track forces?
More than 70 million people.
कितना?
More than 70 million people.
अच्छा, नहीं more than तो 100 भी है, 110 भी है, 90 भी है, 80 भी है. हमें फिगर बताएं.
Just about 70 million.
Sir, percentage बता दें.
परसेंटेज तो नहीं है, आप इफेक्टेड.
Sir, 70 million.
ये जो बहुत recent है वो तो 80 million कहते हैं, लेकिन जो quickly का वो है वो 70.
This device.
Pass.
पास जी इनहिबिटर. जी नहीं, आपका आंसर यही है. गोल्ड में.
वो डिवाइस आता है.
डिवाइस क्या है आपको?
गोल्ड में तुझे
बस मेरे ख्याल में आंसर हो गया.
आंसर हो गया, ये इनकरेक्ट है. वो डिवाइस जो है वो अहमद ग्लाकोमा मोबाइल का है और ये मतीन अहमद है जिसने इसको डिवाइस किया. ओके नेक्स्ट.
अच्छा वाला प्रश्न.
That's the service inhibitor. Girl strand. Yes, girl strand. They said girl strand. इन्होंने क्या आपको नजर आ रहा है वो क्या है? इस बंदे ने थर्मोस्कोप डिवाइस किया. कौन है? ठीक है, so incorrect answer sir. ये this is incorrect. ये -5 group B. Recognize this personality. Trap forces. Actually ये ट्रैप के साथ ही रिलेटेड है.
Pass.
पास ये ग्रुप ए. पास. पास. ओके पास. सो ये है पीटर वाटसन जिसने ट्रेबेकुलेक्टिव में अहम रोल के इसने इसको मॉडिफाई किया. ओके ग्रुप ए साइड कवर्स. व्हाट डू यू सी?
असल के लिए देखिए वो खबर को trap was invented by Keynes and it was modified by Peter Watson. अगर
ये अपने मॉडिफाई वाला नाम देता है ना खुदा का तो बता है. अब तो मुझे ये बल क्वेश्चन just simple question.
Sir, there is optic disc cutting, slight optic disc cutting and slight nasalization of plastic. Optic disc is CDR ratio around about its
Time over.
ठीक है बता रहे हैं. हाँ.
Our optic disc cutting जो है CDR ratio is about 4 or 5, 6 to 7.
So there is also biometric sign and the nectar is also, the ring is also
Yes.
Okay.
thin.
So I will leave it to judges. Actually, it is normal fundus.
Yes.
Okay. Inhibitors. What do you see here? What is the defect?
Income type defects.
Inferior upwards glaucoma. Correct. Group C. What do you see? Trap forces. Dorzolamide belongs to which class of drug for glaucoma?
Carbonic anhydrase.
Well done, correct. Inhibitors, timolol belongs to which class of drug for glaucoma? Beta blockers, correct. Group C, bimotor process. कौन सा ग्रुप है ये? Analogs. Okay, correct. अच्छा ये आप देखें इसके जो कैप है इसको कलर देख के बताएं. Recognize this eye drop by cap color.
Najib finance type paranve.
Najib was related on this. Pass. Pass. Okay. G. Inhibitors. Pass. You try forces. पास और मायोटिक कौन सा वाला होता है? एस नाम क्या है? फाइलोकार्पिन करेक्ट. ग्रुप सी ठीक है. मैच दिस साइड ड्रॉस बाय कैप कलर. ट्रैप फोर्सेस. Pass. Okay. Group A. नहीं है. Inhibitors up.
Tangent or Jerem screen.
Tangent Jerem screen. Correct. Right. Inhibitors. Name this machine. Or it. What is it? Okay. Incorrect. Okay. This is gold man. ये manual. Okay. Group C. Name this lens.
Gonioscopic lens.
इसके अलावा कोई अच्छा. ओके. जजेस टू डिसाइड. उनके पास आंसर है. ठीक है. और
So glaucoma are open angle glaucoma, angle closure glaucoma, congenital glaucoma or glaucoma occurring at birth, secondary glaucoma due to the use of medications, trauma, etc., chronic angle closure glaucoma. Most people who have glaucoma don't have any symptoms. The symptoms of glaucoma may vary according to the type of glaucoma. Most people who are diagnosed with glaucoma don't know much about the disease and its risk factors. People with diabetes are at an increased risk of getting glaucoma. Hence, they should be disciplined with their medications and regularly visit their doctor. The risk factors for getting glaucoma are increasing age, especially greater than 40 years of age, a family history of glaucoma, untreated high blood pressure or hypertension, untreated diabetes or high blood sugar levels, short-sightedness or myopia, high pressure in the eyes due to eye injury, inflammation, tumor or advanced cataract, prolonged use of corticosteroid drops, tablets or ointments. If left untreated, glaucoma will cause blind spots in vision, tunnel vision, and finally total blindness.
C. Trap forces. To practically put the eyes and
Aman Sahab Club and give the honor to give trophy to the winner team. The winner team, and all of you should work hard because there are much more competition coming in life. Now, to present the sheets to our respective judges, I would request again Dr. Zahid Aman Sahab to give sheets to our judges and moderators.
सर सामने देखेंगे प्लीज
Professor Zia Muhammad, Professor Nazir Singh Sahab,
which is the multimedia of it.
now to present sheets to our moderators, Dr. Yusuf Jamal Sahab. Mr. Azmat Jahan. Our chief guest, Dr. Zahid Aman Sahab by Dr. Nolajan.
Thank you very much for really well attended this quiz competition. And first of all, I'm thankful to the honorable judges, Professor Nasir, Professor Nimatullah Kundise, and Dr. Zia, have come here to attend this quiz competition and be part of this Glaucoma week. And worth mentioning is Director Pico, ever dynamic Professor Sanaullah Jan, who is, after becoming Director Pico, has regenerated this Pico Secretariat, and I think at this very moment, सबसे ज़्यादा activity अगर किसी department में हो रही है, this is ophthalmology and Pico. So and worth mentioning to the faculty and the rest of the colleagues who are attending over here. Sanamda se pakalo chair se dil to paste pata hai na the BOG meeting the clinical executive board meeting, he is always fighting for you people. There are promotion which were delayed for quite some time. They have been done. Extra staffing for the stipend for the house of job for the so please be thankful that I'm thankful that you've given me an honor to be the chief guest over here. I always pray for you, do hard work and become a good optometrist and the rest. Okay? Thank you very much.
Dr. Zahid Aman Sahab. Now I would request Dr. Sanaullah Jan Sahab, Director P.
This is, as a healthcare professional, we have to improve and polish our knowledge, skill, and attitude also, the ethics part. It was very nicely organized and nicely structured. The questions that Ms. Yumna and Dr. Mufarek Shah and Dr. Yusuf Jamal, they worked on it. They made this quiz so interesting. Even I was feeling quite high. I mean, the questions, how they were designed, initially they were so easy, and I thought this is piece of cake for the student. But later on, I acknowledged that it is very nicely structured, and then there were difficult questions, and it covered almost all aspects of ophthalmology related to glaucoma. Even the people who were related, who did some innovations, inventions related to glaucoma, they came into the scene and they were introduced in a different way. So I'm really thankful to all organizers. Mr. Azmat was actually the focal person. He was supervised and guided by the seniors. Last but not the least, our guest, our judges, Professor Nematullah Kundi Saab, Professor Zia Muhammad Saab, and our ex-director PICO, Professor Nasser Said. I'm really thankful and obliged for their presence, for being with us on this occasion. And they are always ready to whenever we ask them for any support, for any guidance, they are always there for us. So I'm really thankful to all of you. You are my teachers, you are my mentors, sir. Thank you very much, sir. Professor Zaid Aman is, we used to, when we sit together among our friends, we used to say, Gabinde. He's so polite, so humble. I'm really thankful, Professor Zaid Aman, our Varti Dean, to be with us. He is very busy. He has some additional charges also, but he has to quit everything and rush to our program. So thank you very much, and thank you for this. Thank you very much, everyone.